Hello, and welcome to Cutting Edge Health. If we haven't met, I'm Dr. Orlando Landrum. Here today, I'm here to talk to you about a new study. As a matter of fact, a study that hasn't even been published yet, which we think will make a major impact into how patients experience treatments that are resistant and difficult to treat. Today, we're talking about currently the largest real world study on ketamine that is utilized IV and how it can be able to help improve depression, anxiety, and suicidality. So, what this study is the following. It's the study that's the following: the effects of ketamine on symptoms of depression and anxiety in a real world care settings, and it's a retrospective analysis. So as we've talked about before, a retrospective analysis is basically they went back and they looked at the data to see the type of impact that they had, right? And one of the ways they were able to do this is by using a special type of charting tool that a number of practices agreed to. And that charting tool looks a little something like this. So in larger format, it probably looks a little bit like this. So as you can kind of see, this tool is through a company that's called Osmind. And this tool is one of the things that I've adapted to my own practice, but it looks specifically at mental health. And what it lists here, and you may not be able to see it in print, is three different things. As mental health disorders are one of the leading causes of death and disability worldwide, and they impact more than 1 out of 4 people each year, that clinicians are in need of more evidence-based pharmacotherapy, meaning we need to have a reason for why we do what it is that we do and how we can be able to understand different medications like ketamine. How can it be able to help? How can it be able to stop suicides? What are the methodologies and how well does it work? And this study is one of those things that actually kind of proves that. And then we need to be able to figure out how can we accelerate different product developments in order to be able to bring innovation faster and more efficiently to those patients who need it. So that's what this actual entity is about. And they use this entity in the context of being able to put together this study. So again, the study, for those of you who want to kind of take a look at it, as you can see, it's going to be published on August 15, 2023. So we're bringing you breaking news even before it's broken, right? So let's talk about what it is that they did. So what they did is they took and they did an analysis of patients in 10 different clinics across the US from 2017 to 2020. And they used a number of different studies that looked and assessed patients' symptoms, specifically studies that looked at patients' depression and their anxiety. And what they were able to see is the following: is they're able to see that 2,758 patients were treated, and approximately 714 of them had an analysis for being involved with KIT, stands for ketamine induced therapy, and maintenance is after they've been treated, being able to kind of maintain them on it for a period of time. So they looked at patients in order to be able to kind of identify who's been treated, how did they respond, and things of that nature. Okay. So as a whole, we know that traditionally ketamine is a medication that can be utilized specifically for depression, particularly intravenously. And that intravenous treatment has a number of different things that it can be able to provide relief. The normal way in which is provided is, in the following way. Is that it's traditionally given as a 4 to 8 infusions, and normally those infusions typically take place somewhere over 28 days. The most common utilization is 6 infusions, but it's not always the case. And after you get this induction, which is basically you get treatments for a period of time, then afterwards you can be able to maintain that relief by using less treatments over time. So for instance, let's say you use 6 and you said in the month of July, we're going to spread this out, that maybe we did 2 every week, or we did maybe something like 3 for 1 week and 3 for the next week. Thereafter, in August or September, you wouldn't need to be able to do those same number. You might even do only 1 in September per se. So those are that's the difference between an induction and maintenance. So what are some of the other things that ketamine is used for? Well, it can be utilized for treatment-resistant depression, meaning depression that doesn't respond to traditional medications. It's been useful for anxiety symptoms, and it's been useful for those patients that have bipolar depression as well as suicidal ideation. So let's kind of get to the nitty gritty and say, did it work? Well, these are the charts that kind of suggest that it does. So the blue is depression, the red is anxiety. If you take a look on the left-hand side, it's before starting the treatment. On the right-hand side is after they started the treatment. So pre-induction and after induction. And what you can see is the severity score markedly reduced, at least by 50%, if not more so. So 50% improvement, give or take, in depression as well as anxiety. And I think that's pretty darn impressive, particularly because normally the interesting piece about this is ketamine hasn't historically been studied. And people would say, well, why? It's been out for years, decades even. The main reason why is there hasn't been a monetary benefit to pretty much anybody to why you would use ketamine. And what I mean by that specifically is ketamine is a generic medication. So no company owns the rights to it. So there's normally not a propagation of utilizing ketamine, because if you put it in studies across multi-center trials, no company is going to reach the benefit for understanding that it has an impact on patients in a good way. So the way that this has actually been helpful is that this actual electronic health record that looks at mental health specifically was able to look at providers that's using ketamine, pool that data, and then be able to really show the degree of impact. And so one of the ways that they do that is by this bar graph that shows up in the following. You can be able to see, using that same kind of color distribution, that blue again is depression and red is anxiety, that you got, for the most part, a 49% response, or nearly 50% responder to depression, and the same thing to an anxiety. For what we saw is that most people stayed that way. Half of those patients stayed that way, and that you could be able to treat that with maintenance dosing, as we'll see in just a second or so, in order to be able to kind of maintain that degree of relief. So what most people would ask is, okay, I got better, but will I stay better? Right. And that's what this graph shows for the aspect of depression, where you can see this change in depression severity. And what you're able to kind of really be able to deduce is that after 12 months, how long does this really be able to last for this reduction that's significant in nature? Well, with maintenance dosing done appropriately, is that it's lasting for a number of months to be able to provide relief, significantly going into context of the year. And then someone would say, well, okay, it works for depression. Does it work that same way for anxiety? And this is the graph for anxiety. It's pretty darn close. You can see it tails up just a little bit towards the end, but using ketamine IV intravenously can be able to provide that relief. We're talking specifically about this study today for those of you who are tuning in, which is one of the largest studies that really has looked at ketamine utilization, IV formulation for relief across a number of patients that is significant in nature. So one of the things that I really think is huge for ketamine use is for the following excerpt from the paper, and that's this, is that suicidal ideation was evaluated. So those people who are thinking about suicide, that are considering suicide, and baseline in this sample, about 80%, give or take, had thought about it and had some consideration for it. And what they're able to do is for after treatment, about 70% had some degree of improvement with the utilization of IV ketamine. And the interesting thing, compared to a lot of other different treatments, is IV ketamine in this context in particular traditionally has a fairly rapid response, so that you can intervene before someone commits self-harm. And it's one of the utility of why you would consider using ketamine and then combining it potentially with some other techniques that can help even that maintenance phase that we can see on some of these graphs even be better than what we expected. So how does this look when we compare both of those two things? So this is a little bit different. If you remember before, we had kind of red being anxiety, and we had blue being depression, but this is different. The red are patients that didn't get any treatment whatsoever. And then The blue is those patients who got treated with ketamine. And what you can see as you take a look at this depression score on the left-hand side is that it was a significant difference, statistically significant difference between patients who got treated with ketamine and got a response. And the insight about this is we've known that this provided some value, but we didn't see it across multiple hundreds of patients. We didn't have it across multiple different clinics to be able to look specifically at IV ketamine, which is different than some of the other components of ketamine, because this has both enantiomers, meaning both halves of the chemical, and its degree of potency meaning how powerful it is, how well it responds as responsive and effective, is unique compared to some other quote unquote proprietary modified ketamine utilizations. So what's the summary of all this? Well, the summary is this, is that now this study is able to really kind of be able to show that there is meaningful real world evidence that ketamine intravenous therapy is an effective treatment for symptoms of depression and anxiety when given as a series of infusions. And it's one of the things that we wanted to kind of put out there to patients, that there are clinics out there that are using this. There are clinics who are using this in combination, as mentioned before, with things like Osmind, that can be able to look and track patients in terms of how well you're doing, and also be alerted when patients have an issue, when they have a problem. It can give clinicians, healthcare providers a more effective understanding about how to be able to intervene sooner than not and be able to help save patients' lives and improve their overall well-being. For those of you who are tuning in for the first time, our channel, Cutting Edge Health, helps patients understand how to be able to improve their physical pain, their mental pain, and help punch pain in the face and get back to leading the life that they deserve. If you're interested in learning how to be able to take control of your health, please hit the subscribe button. And if you have comments about this, or you have things where this is personal, leave a comment or two about what you'd like to hear more about, or questions that you may have about how we can be able to improve this, or what you might think. Thank you so much, and have a great day.